Hello, and welcome to this program. I'm Dr. Carol Mountain, the Director of Nursing for Sacramento City College Vocational Nursing Program. We offer two different paths on our vocational nursing program. Some students choose to get an associate degree, while other students choose to do our VN program as a certificate only. This program is designed to be in 3 semesters. So in our very first semester, we call that VN 120. You'll learn about the fundamentals of nursing, where you are meeting the basic needs of adult patients. You might go to a long-term care facility. You're going to learn a lot of things about taking vital signs, doing patient assessments, and learning other things about patient care. In our second semester, that's called VN 130, we begin to look at other age groups. You'll spend some time with the children, and we call that pediatrics, and you may spend some time in maternal health, which is where you might see a woman who is pregnant, or you might see a laboring mother. In third semester, we're looking at more complex needs. So you'll be working with patients that are sicker, you'll be providing additional care, and you'll be spending time in more acute care facilities. We also have time that we spend at the UC Davis clinics, and we spend time at Sutter Rehab. So in total, it takes 36 units to get a vocational nursing degree. A lot of people want to know, how long is the program? What's the time commitment? Will I be able to work another job while I'm in school? Well, this is considered a full-time program. It is 4 days a week. It is usually Monday, Tuesday, Wednesday, and Thursday. Monday and Thursday, we have class. Tuesday and Wednesday, you're in the clinical experience. And Monday afternoon, you do your prep for clinical. So there are varying times for theory and clinical, and all students have to keep a 75% or higher in each class so they can progress in the program. One of the nicest things about Sacramento City College is that we're a very affordable program. When you look at it, it may seem a little bit overwhelming. Our total cost is about $3,875. That includes paying for a background check, a drug screen, an immunization tracker, which is about $115. You need CPR with AED, and it's got to be for a healthcare provider. This needs to be done through American Heart Association, and it usually costs around $60. Books, uniform, shoes, your nurse kit, and supplies are around $1,500, depending on what brand of scrub you decide you're going to buy or what shoes you buy. You also have to have malpractice insurance. It has to be renewed every year. That's $30. Your health stream, that's $14. My clinical exchange is $36.50 per year. And that has to be done if you end up going to Sutter Health. Physical examination, immunizations, PPD, and a flu shot are around $200. And tuition for nursing courses is $46 a unit for 36 units, which is about $1,656. Graduation and licensing fees, right now they're about $300. There's a possibility those will be going up a little bit. And so your total out the gate is around $4,000. It's really important that you have access to a computer, the internet, you have a printer, ink, and paper, because you're going to be doing a lot of work where you're going to need access to your classroom, which is in the online environment. Some students might be concerned because they have somewhere in their background a time that they weren't in such good standing legally, or they may have had some kind of a conviction. So I want people to understand that it is really important that you do your background check, and there are things that you can do. There are 3 instances that the Board of Vocational Nursing and the Board of Registered Nursing both frown on, and that is if you have a history of abuse. If you have had child abuse, adult abuse, or spousal abuse in your past, that's a very hard one for them to overlook, because we work so closely with people that we don't want any of our patients to be abused. So that's one. A second one is a DUI. If you are convicted of a DUI, or you have a DUI conviction in the past, you will need to show that you have been completely rehabilitated. And by that, you have gone through a rehabilitation program. You may have taken some CEU courses. You have letters of recommendation from people saying that you have overcome this problem, and you can show that you have actively worked to get beyond it. The third thing is fraud. If you have had a conviction of fraud, like you have done welfare fraud, that's another thing that they really frown on because it's an ethical conviction. And we as healthcare providers, especially as nurses, it's really important for us to be seen as ethically pure and that we are trying to do the right thing for our patients. So this is something to consider if you've had these as a previous problem. The BVMPT does have the right to deny any graduate the opportunity to take the NCLEX PM, and our clinical facilities also have the right to say this person can't come to our facility because of their past criminal history. If you have questions, you can always check with the BVMPT, and they actually have a couple of videos up on YouTube. Just put in BVMPT conviction history, and they come right up. You'll have the privilege of going to several different clinical facilities while you are in our program. And these change every semester. It depends on what's going on in the rest of Greater Sacramento. And with COVID, things have changed a lot. And so we're very fluid about how things go. But we do usually get to take our students up to Sutter Roseville to their rehabilitation department there. We go to UC Davis Medical Center clinics. We go to Eschaton Care Centers, Sacramento Food Bank, Sacramento Subacute Facility. We have also had the privilege of going to My Friend's Pediatric Daycare and some other wonderful clinical experiences that we have for our students. I do want to emphasize that if you have tattoos, they must be covered per the policy of our clinical facilities. We are guests in the facilities, and so we follow whatever clinical policies they have when we are there. People often ask me what career opportunities are available for LVNs. Well, many different things are available to you, and more things are coming available right now. Healthcare is definitely in a place of change, and so we look to those things to say we're not sure where it's going to be in 5 years. But right now, subacute care facilities hire LVNs, skilled nursing facilities, outpatient clinics, doctor's offices, corrections is a big one. The prisons use LVNs all the time. Laboratories, home health agencies, and a variety of other places do employ LVNs. It also sets you up for those people that are interested. You can become an LVN and come back through our program, taking the LVN to RN transition course, and then going into our LVN to RN transition program. So it definitely is a step in your nursing career, or it could just be where you're comfortable being in your nursing career. There's lots of opportunities that are available, and these are just things for you to consider. I hope this has answered some of your questions, and there are many resources for you and people that you can talk with as you begin this journey or you're thinking of applying to the program to get additional information so that you are prepared to come into this program and to do well. Thank you.